Hello friends, so in this video I will describe the lower limb muscles and their nerve supply. It is just a quick revision so you can use it for the examination purpose. So first let us see the lower limb. Just first thing you have to do is to identify the side of the lower limb. You can identify the right or left limb by the position of the great toe, and you can also identify it by the head of the femur. So here this one is the right lower limb, you can see here, and let us just begin with the front of the thigh. So here we can see front of the thigh muscle. So in the front of the thigh we can see the one oblique muscles. Here you can see it extends from the lateral to medial side, from the anterior superior spine towards the medial side of the upper end of the tibia, and this muscle is the sartorius. And this sartorius muscle, it is supplied by the femoral nerve, and the structures lies above the sartorius on the medial side of the front of the thigh. Here it in the front of the thigh it form a depression which is a triangular in shape. It is a muscular depression which is triangular in shape, present into the front of the thigh in femoral region, and this triangular depression is known as the femoral triangle. So here you can see femoral triangle is located somehow here. So the boundary of the femoral triangle, so you can see this muscle, this is the adductor longus muscle, and femoral triangle is bounded on the medial side. It is bounded by the medial border of the adductor longus. On the lateral side it can be bounded by the medial border of the sartorius muscle, and it having a base which is formed by the inguinal ligament, which we are not able to see here because the lower limb is separated. So this is the femoral triangle. Now you can see apex is directed downward, base is above, and the floor of this triangle, it is formed by, from medial to lateral, it can form by adductor longus. You can see this is the adductor longus. It is a muscle of the medial compartment. Then next to it you can see pectineus. So this muscle is the pectineus. Just lateral to it you can see the psoas major muscle, and just lateral to it there is a iliacus muscle. So iliopsoas, we can together say this iliacus and psoas muscle major as a iliopsoas muscle. Out of this pectineus muscle having a dual supply, it is supplied by the femoral nerve as well as the obturator nerve, and the iliacus and psoas major, they are supplied by we can say here the iliacus is supplied by the femoral nerve root from the L to L3 spinal segment, and the psoas major is supplied by the roots from the branches from the nerve root L2 and L3. Now let us go below to the sartorius in front of the thigh. Just below to the sartorius there are total 5 muscles are located. One muscle is deeper, and the 4 muscles, they are together known as the quadriceps femoris. So 4 muscles of the quadriceps femoris are rectus femoris. Here you can see bipinnate muscle going straight downward from the anterior iliac spine up to the patella. So here you can see this is the rectus femoris muscle. Just medial to it you can see a wide muscle which is the vastus medialis. Lateral to it you can see this one is the vastus lateralis muscle, and when you lift rectus femoris little bit you can see just in between two you can see vastus intermedialis. These 4 quadriceps muscles, they are supplied by the femoral nerve, and when you dissect more deeper you can see at the lower part of the thigh, in front of the thigh, just below the vastus intermedialis, there is a one small muscle is there which is known as the articularis genum, and all these 5 muscles, quadriceps femoris along with the articularis genu, they are supplied by the femoral nerve. So here you can see all the muscles of the front of the thigh, they are supplied by the femoral nerve, except that pectineus, it having a dual nerve supply, it is also supplied by obturator nerve. Now let us move towards the medial side of the thigh. So medial side of the thigh, you can see the slender muscle, thin ribbon like slender muscle, which is a gracilis. So this is the gracilis muscle. Now let us move little bit medial to gracilis. You can see first adductor longus muscle. Adductor longus we have already seen in front of the thigh also. So this adductor longus muscle, this one is the adductor longus. Just when you lift this adductor longus muscle, you can see adductor brevis muscle just below the adductor longus. The same direction muscles obliquely downward and laterally. Okay, so this is the adductor brevis muscle, and below to adductor brevis on the medial side, you can see adductor magnus. It is the largest muscle of the adductor compartment, and you can see it is widely spread downward of the thigh also. So all this muscle, adductor longus, brevis, magnus, gracilis, all of them, they are supplied by the obturator nerve. And so we can say that all the muscles of the medial compartment of the thigh, they are supplied by the obturator. Now obturator nerve having a two division, anterior and the posterior division, which is divided by adductor brevis muscle. So now when you see that the anterior division of the obturator nerve supplies the gracilis, adductor longus muscle, as well as it also supplies the adductor brevis muscle. So we have seen the anterior compartment and the medial compartment. Now let us move on the posterior side. Okay, so as we move on the posterior side of the thigh and also the gluteal region, let us see first gluteal region. As this lower limb is dissected, we may not be able to all the muscles, but let us see. We can see the largest muscle. This one is the gluteus maximus muscle. You can see here quadrilateral muscle, direction of the fibers are downward and laterally, and this gluteus maximus, it is supplied by inferior gluteal nerve. Just deep to it, this muscle is gluteus medius muscle. Okay, and this gluteus medius, it is supplied by superior gluteal nerve. Just deep to it, fan shaped muscles, you can see fan shaped muscles, right? Gluteus medius is also a fan shaped muscle. These two muscles, above medius, below gluteus minimus. This gluteus minimus is again, it is supplied by the superior gluteal nerve. There is another muscle which is supplied by the superior gluteal nerve. It is a tensor fasciolata. Here we can see along with the gluteus maximus, there is a tensor fasciolata muscle is attached. Okay, so we have seen maximus, below it medius, below it minimus, and this is the piriformis muscle. This piriformis muscle is the key muscle of this region. When we reflect this gluteus maximus from its origin, we can see one triangular muscle above and below. From this muscle above and below, the nerves and vessels passes. Above there is a superior gluteal nerve, and below there is a inferior gluteal nerve, and other structures like sciatic nerve passes. So this is the key muscles. First we identify the piriformis, then above we can identify there is a gluteus medius. When we dissect the medius, we can see the minimus. So this is a piriformis, and it is supplied by the ventral rami of S1 and S2. Now just below the piriformis, we can see these are the three muscles. We can see two gemelli with the obturator internus. Here you can see the two small muscles, superior gemelli, just below it obturator internus, below it inferior gemellum. So the superior gemellus, it is supplied by nerve to obturator internus. Obturator internus is supplied by the nerve to obturator internus, and inferior gemellus, it is supplied by the nerve to quadratus femoris. And this quadratus femoris muscle is lies just below to obturator internus, and quadratus muscle, it is supplied by the nerve to quadratus femoris. So these muscles are lying in above downward manner. We can see the gluteus medius first below piriformis, then two gemelli with the obturator internus, so superior gemelli, then obturator internus, then inferior gemelli, then we can see the quadratus femoris muscle. Now let us go little bit below, it's at the back of the thigh, and at the back of the thigh we can see the muscles which are known as the hamstring muscles. Okay, so on the back of the thigh we can see the hamstring muscles. So hamstring muscles have some characteristic, like they origin from the ischial tuberosity, they inserted on the one of the bone of the leg, they are supplied by the tibial part of the sciatic nerve, and they act as a flexus of the knee joint and extensors at the hip joint. So these are the common characteristic of the hamstring muscles, and hamstring muscles include semimembranosus, semitendinosus, bicep femoris, long head of the bicep femoris, you can say, and adductor magnus. So let us see the first muscle. So this one is the slender tender like muscle. This is the semitendinosus muscle on the medial side. You can see semitendinosus muscle. Okay, just below the semitendinosus you can see here, this is the semimembranosus muscle, again on the medial side. Then let us move towards the lateral side, on the muscle which inserted on to the fibula. You can see here, this is the bicep femoris muscle, it having a two head, long and the short head. You can see the long head is arises from the ischial tuberosity, so this one is the long head, you can see here, and the short head, it arises from the linea aspera of the femur. So you can identify or differentiate the two heads of the bicep femoris by this manner. Now just little bit below and little bit deeper, and on the medial side you can see this is the adductor magnus muscle. So adductor magnus is visualized from the both the side, as it having a two head. The ischial head, it arises from the ischial tuberosity, you can see here, and the adductor part which arises from the ramus of the ischium. So this is the adductor magnus muscle, and as we know, all these hamstring muscles, they are supplied by the tibial part of the sciatic nerve, whereas only the short head which is supplied by the common peroneal nerve of the sciatic nerve. Remember one thing here, that adductor magnus, this muscle is also supplied by obturator nerve, so it having a dual nerve supply, adductor part by the obturator nerve, hamstring part by the tibial part of the sciatic nerve. So this is the back of the thigh, and here on the back of the thigh, just little behind or below and behind the knee joint, we can see here the popliteal fossa, and you can see it is a rhomboid shaped fossa having a four boundaries: supralateral, supromedial, infralateral and inframedial boundary. So popliteal fossa, it is bounded on the supromedial side. Here we can see it is bounded on the supromedially, it is bounded by semitendinosus, semimembranosus. On the lateral side, bounded by biceps femoris. Below, it is bounded by, on the inframedial side, medial head of the gastrocnemius, and on the lateral side, lateral head of the gastrocnemius, which is supplemented by the plantaris muscle. So this is a rhomboid shape popliteal fossa with the four boundaries and contains our tibial nerve, common peroneal nerve, which is a branch of sciatic nerve. You can see sciatic nerve here. This is the tibial nerve and this is the common peroneal nerve. And you can also see deep to it. This is the popliteal vein, and more deeper you dig, you can see the popliteal artery and their branches. So this is popliteal fossa and their boundaries and their contents. Just remember that I am going too fast and it is just a revision for the practical purpose. So read this popliteal fossa in detail from your book, from your textbook, reference book, so you can write it into your exam. Now let us move on the leg. So let us see front of the leg. Okay, so in the front of the leg, which is also known as the extensor compartment, remember that in lower limb the extensor compartment are located in front side and the flexure compartment are located on the back side. As there is a rotation of the limbers, the direction of the limbs are changed. Now, so in the front of the leg and the dorsum of the foot, we can see around the ankle there is a two retinaculum, superior and the inferior retinaculum. The superior retinaculum is just like a band from the tibia to the fibula from its lower end, while the inferior retinaculum is Y-shaped, and they are most commonly asked during the exam. Now let us see muscles from the medial to lateral side in the front of the leg. We can see first this is the tibialis anterior muscle. It is a spindle shaped belly. You can see this one is the tibialis anterior muscle. How you can identify? So it is inserted onto the medial cuneiform, so it passes on the medial towards the medial border of the sole. So this is the tibialis anterior muscle. Just lateral to it you can see extensor hallucis longus. So as it goes inserted on to the hallux, we can see the extensor hallucis muscle. This is the extensor hallucis. More literally you can see extensor digitorum longus. As it says digitorum, it having a 4 digits digital insertion, so you can identify it by that extensor digitorum longus. More literally you can see the peroneus tertius, and this muscle is inserted on the base of the fifth metatarsal bone, so you can identify the tertius by it passes towards the left border of your sole. So this is the peroneus tertius muscle. And the extensor digitorum brevis is the muscle of the dorsum of the foot, which arises from the anterior superior part of the calcaneum, and it is a small muscle of the dorsum of the foot. So here you can see the extensor digitorum brevis. So from medial to lateral, tibialis anterior, extensor hallucis longus, extensor digitorum longus, peroneus tertius, and deep to it there is extensor digitorum brevis. And the muscles of the front of leg, they are supplied by the deep peroneal. Now all these muscles, all these 5 muscles, they are supplied by the deep peroneal nerve. And the two structures which is the deep peroneal nerve and anterior tibial artery, they are found between the extensor hallucis longus and extensor digitorum longus. And here the mnemonic, you can remember the structures passes in front of the lower end of the tibia or just under the extensor retinaculum. By this mnemonic, tall Himalayas are never dry places. T for the tibialis anterior Himalayas stand for the extensor hallucis longus. R A stands for the artery, anterior tibial artery. N stands for the nerve, deep peroneal nerve. D for the digitorum longus, here the extensor digitorum longus, and P stands for the peroneus tertius. So this is about the front of the leg and dorsum of the foot. Okay, and Next we will move to the medial and the lateral side. Okay, let us move on the lateral side of the leg. So at this side you can see there are two muscles are present, the peroneus longus and peroneus brevis muscle. You can identify this muscle by its insertion. Just look at this. This peroneus longus is inserted on the lateral side of the first metatarsal bone at its base. So you can see this tendon is traveled from the lateral to the medial side, and the peroneus brevis, it is inserted on the base near the tuberosity of the base of fifth metatarsal. So you can see the insertion of peroneus brevis. Out of these two muscles, the longus is superficial whereas the brevis is deep. But when you see this muscle just deep to the peroneus retinaculum, which is located over here, so just deep to the peroneus retinaculum, the peroneus brevis lies on the uh, superficial, peroneus brevis lies superficial, and longus lies just at the lower part of it. So these two muscles, they are supplied by the deep peroneal nerve. Just remember one thing here, there are three peroneus muscles: peroneus longus, brevis and tertius. And out of these tertius, it is muscles of extensor compartment. You can see in the front of the leg, whereas the brevis and longus are the muscles of the lateral compartment, and these two are supplied by the deep peroneal nerve, whereas the tertius is supplied by the superficial peroneal nerve. Okay, now let us move on the back of the leg. So back of the leg consists of three superficial muscles. They are the gastrocnemius. You can see this is the medial and lateral head of the gastrocnemius, and just deep to it you can see the soleus muscle. So these three muscles, they are together known as the triceps surae, and they are supplied by the tibial nerve. These three muscles, means medial and lateral head of the gastrocnemius and soleus, they together form a thickest and longest tendon of our body, which is known as the tendocalcaneus. Here you can see the tendocalcaneus. So this is the tendocalcaneus inserted on the middle part of the posterior surface of the calcaneus. So triceps surae. Now let us see the deep muscles. So to identify the deep muscles, we have to move on the medial side, just behind the medial malleolus of the tibia. So let us see. First muscle, you can see that this is the tibialis posterior. Here you can see this tibialis posterior. It is mainly inserted on the tuberosity of the navicular bone, and the rest of the slip will passes to all the tarsals except talus, and also it passes to the first, second and third metatarsal. So the insertion of the tibialis posterior is most important. It may be asked in the viva or in exam also. Just behind it you can see the flexure digitorum longus. So this is the flexure digitorum longus muscle. As we can see, it having a digitorum word, so it divided into four slip. So this is the flexure digitorum longus. Just deep to it we can see the tibial nerve. This is the tibial nerve and posterior tibial artery. You can see the posterior tibial artery also here. This is it. Just behind it you can see the flexure hallucis longus. So you can see this is its tendon passes towards the hallux. So this is the flexure hallucis longus muscle, and so all these three muscles, they are supplied by the tibial nerve, tibialis posterior, flexure digitorum longus and flexure hallucis longus. They are supplied by the tibial nerve. They are the muscles of the deeper compartment of the back of the leg, and they are the flexures, as the posterior compartment is flexure in lower limb. So These three muscles are the flexure muscles. So in the back of the leg, between the gastrocnemius and soleus, we can see the slender tendon, thin slender tendon which look like a nerve. This is the plantaris muscle. You can see here, this one is the plantaris. Between the gastrocnemius muscle and the soleus, you can see its tendon, it lies just lateral to the tendocalcaneus. This one is the tendocalcaneus, just lateral to it there is a plantaris muscle. So it lies on the back of the leg, just deep to the gastrocnemius.